joining us to talk more about cannabis and its medical use. And this is fascinating. I don't know if a lot of people even realize that you can use cannabis to treat your pets, depending on what their illness is. Joining us, as we said, from the Vancouver Animal Wellness Center, Dr. Katherine Kramer joins us via Skype. Dr. Kramer, thanks for joining us.
Oh, thank you for the opportunity. I'm always happy to talk about CBD.
Well, so let me ask you first, you've been a veterinarian a long time. When did you come across, when did you first realize that maybe cannabis was an option for some of your patients?
About 5 years ago, I had an elderly cat, about 18, with multiple issues, pancreatitis, arthritis, heart disease, kidney disease, you name it. And we were basically keeping this cat almost comatose on conventional pain medication to keep him comfortable. He was miserable, he wasn't eating, he was just, we were facing euthanasia. And the owner fortunately worked for one of the compassion societies and said, I really would like to try CBD. And my response, I was glad he was open enough because it has really changed the way I practice. My response was, I have no idea about this, but it's worth a shot because we don't have much to lose. And we experimented with the dose. We started slow, and within a few days, this cat was eating again. And within a week or so, we were able to start taking him off some of his harder medication. And lo and behold, this cat lived another 2 to 3 years, and like really good years, good quality. And after that, I was hooked, so to speak. If it worked so well for this patient, what about this? What about that? And now, here we are 5 years later. And I would say majority of my patients are on some form of CBD.
Before I get into what's going on now, I just want to go back to that 5 years. How surprised were you about the results that when you first dealt with it with that first cat?
From a scientific point of view, I was pretty well aware of the benefits that people have seen using it for different medical conditions. And I've always been open. I come from a music background. My husband is a musician, so it's not like it's a foreign substance.
Right.
But honestly, some of the cases that I've seen, I'm just bowled over. I've had a few cases where it's nothing short of a miracle.
What's been so you have that moment with that first cat, and I think we talked about it earlier. It's like a eureka moment. Wow, where else can I use this? Who else can I help? What was the reaction from, I wonder, pet owners when they would come in and you'd go, you know what, I think we should try? What was the owner's kind of reaction to you?
Well, in our hospital, we're an integrative practice, so we already play around with a lot of unusual therapies. I have an interest in traditional Chinese veterinary medicine, so I do a lot of acupuncture. I do Western and Chinese herbs already. We offer homeopathy, we offer chiropractic therapy. So a lot of people are seeking us out anyway. We see a lot of patients where Western medicine has failed them. And so they're already seeking something unusual. I have had a few, chuckles, and it's like, oh, you want to get my dog high?
Right.
Like, no, we're not talking marijuana. It's a good educational point to say we're talking CBD. THC, absolutely toxic in animals, and we've had a couple of problems with some of the dispensaries where THC products have been dispensed instead of our CBD, and we've had a couple of patients end up in emergency hospital, and some that came in and were thinking, it's time, we have to euthanize our pet, and it was no, they had just gotten the wrong product. So
that's a really interesting point, because I think the first thing I heard when I said, oh, a veterinarian, they can give their animals, their patients CBDs, I said, isn't that dangerous? And it was like, no, you're confusing it. So there is a lot of confusion out there, isn't there?
There really is, and honestly, I would be glad when we get to the point where I can have a product on my shelf and I can say, yes, I can recommend this, and here is a safe, quality, controlled product. At this point, the colleges point of view is that this is experimental, it's illegal, and as a veterinarian, I'm not allowed to talk about it. I'm not allowed to prescribe it. And after 5 years, I'm just starting to chat with the college about what I'm allowed to say and what I'm not. As rampant as it is and widely available, I would say, majority of pet owners are already using these products and not telling their vets, which I'm always happy to talk, I have a forum like this to say, if you're interested in it, please talk to your vet, because pet owners are going to be the ones that nudge the veterinary community into becoming more proactive about using CBD and doing the research that we need.
So, Dr. Kramer, for 5 years, have you been breaking the law every day?
Well, depends on who you ask, I suppose.
Yeah.
When people come to me, and I do have a lot of people that seek me out because word has gotten out that yes, I'm open to it, and we can chat about it. I tell people that yes, I'm by my college rules, I'm not allowed to prescribe or recommend, and these are the side effects, these are the potential complications. And if you still want to use it, then I will tell you where to get it safely. I will tell you how to use it safely. And I will stand by that, absolutely.
Now, you mentioned side effects. I'm just curious, now that you've had 5 years in, I'm sure you're well aware of what the side effects are of the traditional painkillers and medications that you've been giving to the cats and dogs that come in. Did you notice a difference? There still must be some side effects with the use of cannabis?
No, there's side effects with everything.
Right.
One of the benefits of cannabis is that we typically don't see the harsh side effects that we see with narcotics, with opioids. There are a lot of pain relievers on the market for dogs with arthritis, but a lot of dogs can't tolerate those medications. With cannabis, we usually can see some lethargy. Some of the dogs and cats are pretty sleepy when we start, so we always start with a low dose. There have been a few that seem to be allergic to the hemp, which goes without saying. And occasionally, I've had a few patients that actually seem very anxious or wired with it, and the great thing is we stop it, and those side effects go away pretty quickly.
Does it work better in certain animals other than other animals? Like, is it better in cats than dogs, birds? Like, what kind of wide range use have you been able to kind of try?
Well, I've only tried it in dogs and cats,
Okay.
although I get calls weekly about ferrets and rabbits and horses and cows and sheep and, everything. Looking back historically, cannabis was used at the turn of the century in large animal medicine as a pain reliever. As far as cases go, I see huge benefits in patients with seizures, with anxiety, with arthritis, and any type of chronic pain. Unfortunately, I do a lot of cancer work, supportive care, and geriatric palliative care. And it's, like I say, it's in some patients, it's been a miracle.
It's amazing. And as you say, it was thrust upon you just because, there was one patient that, wasn't sure what to do next, running out of ideas. And that's funny the way that kind of opens the door for other things. Where do you see it? You must be relieved to some degree that legalization, decriminalization is coming. Where do you see things going?
I'm really relieved, and I'm very proud of the American Veterinary Medical Association, who is calling in the States to have cannabis rescheduled so it can be researched. The Colorado State Veterinary School has 2 cannabis research projects going on right now for dogs with arthritis and dogs with epilepsy. So I'm hoping that as more people, and again, pet owners are usually the ones who drive this, by demanding, an alternative, a safe alternative for, medications that are, they do have side effects and are harmful. And I think, the more the word gets out, the more interest there is. When I started talking about this 5 years ago, I would talk to anybody who would listen about it. And now I get calls weekly from all across North America, from vets and research institutions and people, pet owners, who are really concerned about, they need an alternative. So, and everyone is more open about it. Years ago, I talked to a veterinary oncologist back east who was very interested, and I said, "You need to be vocal about this." And she said, "I can't. I have tenure. I'm fortunate not to have to worry about that."
Right.
So, but more and more vets are interested in it, and more the people who make policy are interested in it. So I'm hoping by this time next year, I can have a product on my shelf that I can absolutely say, yes, I can prescribe this for your pet.
Doctor, I'm just going to get some questions from those folks that are watching us on Facebook. We'll get the lovely and talented Camille to bring them in. Let me ask you while I wait for the questions. Oh, here they come. What was the reaction at the beginning? Oh, thanks, Camille. From your colleagues. Did they were they open to it? As you said, you're talking to one from out east. Yes, they were open to it. Were others looking at you like, no, you're crazy. Don't waste your time?
Well, I get a lot of that anyway because of the acupuncture and the herbs.
Right.
But I see the cases that nobody else can fix, and I'm okay with that. I would say the majority of vets that I get a call from, it's very much like, okay, away from the public, I do want to know about this, and let me, tell me everything you want to know. Publicly, it's still, no, we can't. Don't even ask me about that.
Right.
And I've gotten tons of patients from other vets who say, I'm going to send so-and-so to you because they want to use CBD and I don't want to touch it.
It's fascinating.
And it's fair enough.
Yeah, no, at least they're not stopping the patient. At least they're recommending and at least sending them on to you, referring them so the patient can get the kind of care they want. This question we got in from Sarah. She says, what methods are used to administer CBDs to animals?
Right now, the tinctures seem to be the most effective. In the States, there are actually some very good preparations out there, and I can certainly, I'm happy to name brands if that's wanted. In Canada, it's been really limited. We in Vancouver have been working with private dispensaries, and you can use tinctures. You can use some of the places will have capsules. I actually talked to someone recently who's working on a transdermal preparation, which I think is going to be great for cats.
It's amazing. Things are coming up that we didn't even think about, like just different uses and different treatments and different things that we could be using cannabis for that, for most people, they just think about the issue of whether it's legal to smoke a joint or not. It's such a bigger question.
Oh, absolutely. It's a medical need. There have been tons of studies on, with people and lab animals, but not a lot on dogs and cats. But within the last 5 years, the patients that I see, it's very, very rare that I have a patient that doesn't do well. A great story of a lab with lymphoma, cancer of the lymph nodes, who came to see me, and they had already scheduled the euthanasia appointment because this dog was just so miserable. And they came to see me and said, can you offer a miracle? Can you do anything? And I said, geez, I really don't think so, but you can try. We'll try some CBD and see. I know it's not going to hurt. And sent them away. We started, I think, a Thursday night, and I asked them, to give me a call in the next couple of days and let me know how things went. And I didn't hear from them for a few days, and I called them back the next week and a little bit worried, thinking they had kept their appointment to euthanize the poor dog. And she picked up the phone and started crying because this dog, I get choked up talking about it. This dog's favorite thing to do was to, grab his leash and go to the local park and play ball. And this dog hadn't done it in months. And after starting the first dose of CBD, the dog stopped and then woke up in the morning, grabbed his leash, dragged them to the park, and played for the first time in months. And he lived another 6 months after that.
That's a great story.
It's a fabulous story.
That's a great story. Dr. Kramer, thanks so much for spending some time with us today. We really appreciate it, and I have a hunch we may continue to check in with you as things progress and we move closer and closer to legalization.
That'd be great.
Thank you very much. That's Dr. Katherine Kramer, again, the Vancouver Animal Wellness Center.